understanding the struggles of my people because of what I have experienced, and my mother, who was abused as a child, who was abused as a wife, who fell on ice on a lunch break and hit her head and went into a coma, subsequently developed seizure disorder and chronic headaches, became addicted to pain meds, and had an opioid addiction for many years, which led to my emancipation as a minor at the age of 16. My decision to do that, not because I didn't love my mother, but because she was relocating to go across the country. And I knew that if I stayed in the city that I was in, that I would be able to go on to any college that I wanted to because I was at an excellent high school. And that's how I thought. So I was pretty mature as a kid, but the focus is there because of all of that, because I understand the stories that go into why a person's health evolves the way that it does. My focus is because I have the education to provide me with the gift of having the language to describe what I'm seeing and experiencing, have experienced and seeing as far as my patients in the community that I serve. To have the language is power. And when I say that, I mean, oftentimes people they know something's not right, but they can't really articulate what it is that's wrong. And that's when you feel powerless, and that's where you fall off and you make decisions that may not be the best ones for you, but they were the best ones that you could see from the choices that were presented to you. And so my focus comes from education that gave me the language to be able to speak to problems that I see before me, but also to become a part of the solution to make things better for the community. So focus, comes from my faith on the spiritual side, but it also comes from the scientific community and the advocacy community as far as health justice and racial justice, which is paramount in being able to get our people back to a healthier place as a community.
And then I applied to medical school and didn't realize how much I really wanted to give back to the community. It was kind of just ingrained in my head. So I was fortunate enough to get accepted into Charles R. Drew / UCLA medical education program, which focuses on underserved medicine. And, part of my experience that I later come to realize that was really impactful was growing up without health insurance. So we, as a family, never had health insurance. I didn't have health insurance until college, and even then I didn't even use it. Didn't really use my health insurance until I went into medical school. And fortunately enough, we were all pretty healthy. If any of us got sick, we would have to make the drive to Tijuana, which was anywhere from an hour and a half to 2 hours, and seek out medical care there because we couldn't afford medical care in the United States. And so that was kind of my exposure to medicine and underserved communities. And so for me, when really applying to medical school and my experiences and really noticing that people should have the right to have access to healthcare, and it really should not have been a privilege. And I wanted to be part of the solution and not part of the problem. And so for me, that was a big part of what I wanted to do with my medical career, is really serve those that do not have access or have minimal access to health services. So that had a big lasting impact on me, and I am very committed to continuing this great work, and I'm very fortunate to be able to be involved in the lives of my patients that are so incredible and so hardworking and just so deserving of really high quality care. And so that's a little bit about my journey into medicine.
As I previously stated, St. John's is an amazing organization. They really, really, really strive to ensure like our underserved population has health equity. And that's really, really important because I believe health equity should be a right, a human right for all of us. It shouldn't be certain people that should have access to it and others that should not. I feel that that's something that should be equally distributed amongst any population. And I think St. John's is an organization that actually believes that, stands by that, fights for that right for the members of this community and the community that they serve. So being a part of an organization like that, I think that does have a very strong impact on me professionally, not only professionally, but just overall, like emotionally. I think that kind of helps. It makes me want to be a part of something great. And I feel like I'm a part of something great. Not only want to be, it makes me feel like I'm a part of something great, something that'll change lives.
Beautiful.
Because in healthcare myself, I grew up and never had a Black doctor in my whole life. And so me being one, I felt it was important to be in that role also. In some ways, for some patients, having a provider that, that they can relate to, that they feel may share their journey or share their experience can be more, make an impact. And that may be individually one by one per patient, but then as I get toward leadership, doing that on a higher level, managing with policy and programs, et cetera, that can impact a greater part of the community. And again, being a presence.